let's start with tell us who you are, Aaron Carroll.
I'm Aaron Carroll. I'm a health services researcher and I'm a pediatrician. I'm an associate professor of pediatrics at Indiana University School of Medicine.
And I should say that you and I have been colleagues on the Incidental Economist and publishing together in the New England Journal of Medicine, and have been active in this game for a while. How did you get started as a sort of health policy commentator or blogger?
I think it started mostly because I think I was doing radio first. I had written a number of papers about physician views on healthcare reform, and so when healthcare reform became a bigger deal back in, I think, 2007 probably, and when President Obama, well then Senator Obama, I think, went to talk to the AMA, maybe he was president then, some of my work came up and I started doing radio again because people were interested in how physicians would feel about healthcare reform. And after doing that for a while, people kept saying to me, well, why don't you blog? Why don't you actually write about this? And I resisted it for a long time, partially because writing at that time really wasn't my gig. And the idea of doing it every day just seemed daunting. And to be honest, there's a bit of a fear factor because when you start, no one reads it. And just getting your close personal friends to take a look is difficult.
And sometimes that's more painful than anything.
Oh, yeah. I don't think most of my family still read any of my blogs, but I started doing it, and I found that there was sort of a need for people that would sort of bring evidence or research or data to the discussion of health policy. And at first I was doing it on my own blog, which was called Rational Arguments, and I'm sure I had no readers at the beginning, and then when I started to finally track it with Google, I had in the tens, and it was very exciting. But I think a lot of the radio that I was doing started to get some traffic, and then I actually started to pick up some pieces from Austin Frack, who was the one who started the Incidental Economist, and we would cite each other's work periodically, and then we actually started talking about it. And then one day he asked if I might be interested in joining. And at first I resisted because I'm not an economist, and I'm a health services researcher. I'm a doctor, and so while there I think is overlap of the work, his seemed like a different site, and I wasn't quite sure. But his traffic, I think at the time was bigger than mine, and it seemed like a natural fit, and so we joined up. God, I think about a year after I started blogging, so it probably would have been about 2010, I think. And then things started to really take off, and we found that there's just this need. There's this hunger for people who sort of are embedded in the research and willing to sort of examine the evidence and use rigorous methods, but still give it a voice. And so we like to say all the time, it's like, I have an opinion, but my opinion is formed by data and evidence. It's not that I have a belief and I will go out and find data and evidence to support that belief. And so that's really what we've tried to do. Obviously, you've joined us since then. And I think it's what we do, but it's incredibly valuable. And it's turned into an incredibly rewarding experience. And there's almost no aspect of my job that I enjoy more these days. And it's stunning to me, given that writing at the beginning was such a chore and something I did not want to do, that I do so much of it now.
One of the things that's really striking about your blogging are the great graphs that you make. I think that you are, I guess Ezra Klein is ahead of you in terms of name recognition for graphs, but you're but you're close behind.
I appreciate that. We try. Of course, we're all behind him in name recognition of nearly everything.
My favorite Aaron graph, I think, was well, I think there's two that I'm just going to note for readers. One is there's a fantastic graph which just shows changes in life expectancy above and below median income for male workers once they reach retirement age. And what's really striking is almost the entire gain over the past 30 years in life expectancy is basically in the top half of the income distribution. And if you look at the people below in the bottom half, they basically experienced almost no increase in life expectancy at all over that period, which is really quite. If you want to know the consequences of inequality in America, that's That's really a striking one. How much did it go up in the top half? I've forgotten at the moment, but
I
it's
think about
years.
5 years.
Yeah.
Even that, just not nearly as much as people will quote in sort of the lay media. They'll throw out numbers like 14, 15, even 16 years. And life expectancy at 65 has gone up, but as you say, it's almost entirely concentrated in the top half. Not even the top, small percent. The top half of earners, between the bottom half, have barely gotten a year. And to talk about taking away 2 years of their Medicare is basically robbing them of a total year. It's not compensating for any kind of growth. Moreover, it's very likely that there's a lot of people in there who've had their life expectancy stay stable or go down. It's not that everybody in the bottom half has gone up a year. So it's a very, very regressive policy.
Yeah, well, I think you're writing about the utter stupidity of increasing the Medicare eligibility age had a real impact because it turns out it actually costs the health system money.
Yeah.
It is people are not living longer to the extent that most of us think, and it's really shifting costs onto individuals and states and employers away from the federal government in a way that really doesn't address any of our problems except for it does a little bit, it helps a little bit for the federal budget, but only because it's pushing off all these responsibilities onto other people who are less able to take it.
I feel like the only need that it fills is some sort of deep-seated desire among some sense of the population that we have to take Medicare away. I mean, it's like or just cut it. I mean, just make it less, for no objective reason. Because there's plenty of debates that we could have of ways to trim Medicare spending, but there's not one that just seems so silly. I just can't. I can't even find another word for it. It just makes no sense in any way. It potentially could harm people's health. It costs people twice as much as we save. It's regressive. It's not compensating for any kind of life expectancy increase, and so almost any way you look at it, it just doesn't make sense. At least some ways to cut Medicare, you can make some argument for it that's based in rationale, and you can discuss the trade-offs of it. But that one just doesn't. But I think it gets back to your point. My favorite charts are the ones that that just basically dispel deep-seated memes or beliefs, things just people know to be true. I mean, just people just inherently believe we're living so much longer than we were 30 years ago that we have to extend or raise the Medicare eligibility age, and that's just not true. One of my favorite charts still, and there's two of them which actually are very similar, but one of them is just sort of where I just made a pie chart of the number of Canadians that come
That was
to the
my
United
second one. Yeah, tell me about that
Oh,
one.
okay. That one actually, I think it was the Daily Dishes chart of the year, like a year or two ago, and that was a big deal again when I'm a little blogger at the time. But the number of Canadians who come here is just barely seeable on a chart, and yet everybody seems to believe they know someone who came here. And in the same way, another of my favorites is the same kind of thing. It shows the actual dollar savings that we could probably see in the healthcare system from tort reform, which again is almost unseeable. It's this thin line that you can drag out of the pie chart, but everybody just knows malpractice system is why healthcare costs so much in the United States, and it's just not the way to solve it.
Well, one of the problems we have is, I mean, it comes down to some of the work that Danny Kahneman and people like that have done on the psychology of decision making. There are genuine and real, vivid examples of people coming from Canada. Some of those have been exaggerated in the retelling, but there's real examples. There's real examples of ridiculous malpractice settlements. There's real examples of all sorts of stuff that are just not very common at all. And so, in fact, one of my in my own work, I do a lot of work in violence prevention, as you know. People are terrified that a homicidal stranger is going to come in their house and kill them. And it turns out that if you actually look at all the cases of homicides in the United States where the motive is listed as burglary, it turns out there's 100 in the United States, all across the whole United States in a year. So it's not zero. So it's enough you can imagine, there's a great story on cable TV about it that's genuinely scary. In Chicago, there was one. And, in a year. And so people are, and when you think about the risks of suicide and of accident and of someone getting hold of that gun and doing something terrible with it, if the reason you're having that gun is the fear that some stranger is just going to kick your door in and you've got to have that gun there to fight it out, it's just a really, really rare risk, but it's a very vivid and scary risk, and so people think it's more common.
And your point is so good, and I have to bring up even an anecdote to discuss this because I'm curious to get your opinion of it. But my daughter is about 6.5. She's in first grade, and after the recent shooting, the school felt this intense need to discuss this with the students, including my daughter, who's a first grader. And they've even done drills on what to do. And in the past week, she can't go to sleep. She cries every night because she's scared a man's going to come through the window and shoot her. Because this is what, and I'm just, why do we even tell kids? I'm sort of baffled about this because, again, the actual likelihood of this happening is zero. I mean, it's just infinitesimal.
And there's no positive action that comes from
No.
from you know. There are some people who should be talking about this.
Sure.
I want the school
Absolutely.
administrators to be talking about it and thinking
Sure.
about other things we might do that would make our kids safer. And
Sure.
but let's not put it on the first graders to have the
No.
emergency crisis response.
But I see this is almost, I feel like, how it gets started, of just like, now she's panicked about this. Now she believes this is something that's very likely to occur.
Yeah.
And it strikes me that this is how it starts. The anecdote is so powerful. And I see this in adults as well. And we see it in all kinds of things where, people just because they think it's possible. I remember when Plan B was a big issue, and they were talking about adolescents could get a hold of it. And the likelihood that they could take it and then they could overdose, or there could be a problem. And people kept saying it'll be right there next to the batteries. And I remember going to the FDA, or was it the FDA, or it was the Poison Control website. More people die of battery ingestion every year than of many drugs. And I'm like, it turns out batteries are far more dangerous than Plan B. It's
even
like
for overdose, yeah.
And it's but we buy into this fear, or this sort of inflating the anecdote or the individual thing, and we lose sight of just the perspective of how dangerous it is. I could do this all day, but I remember when SARS, everybody was panicked they were going to die of SARS, but no one talks about flu, which kills, of course, tens of thousands of people every year. And but SARS killed zero. It's just we can't seem to focus on the things that are.
We're going to have a nonprofit advocacy organization. We're all going to meet at Burger King and talk about how frightened we are about the power lines that are over.
Yeah.
That are going to be put in over our house. And
right.
It is. And what can you do?